So in looking at her presenting symptoms, physical exam, and blood counts, this is not at all atypical for patients. And in fact, patients like this may be seen by a number of specialists and primary care physicians before they actually get to the hematologist. So if a blood count isn't checked and they're having abdominal fullness and night sweats or pruritus, which is quite common, fatigue, a number of evaluations for other disorders might have ensued before finally getting to the blood count and showing that the problem is in the bone marrow. So this is quite typical. Now, the natural history of myelofibrosis is quite varied. Some patients having a very long survival and some much shorter. And a number of prognostic staging evaluations or models have been developed. The first that we've been using is the Cervantes Criteria International Prognostic Score, where there are 5 prognostic factors. Age over the age of 65, which she has, presence of constitutional symptoms, fevers, night sweats, and weight loss, which she has, anemia with a hemoglobin under 10, leukocytosis with a white blood cell count over 25,000, and the presence of more than 1% circulating blasts. And that's the only one we don't know that she has, but she has all the other 4. If you have none of those factors, then you have low-risk disease with a median survival that exceeds 10 years. However, most patients, 90% of patients, will have intermediate 1 risk disease with 1 risk factor, intermediate 2 with 2 risk factors, or high risk disease with 3 or more risk factors. The median survival gets progressively worse with each of those. For patients with high risk disease, the median survival is only about 2 years.